Hi friends, I'm Dr. Deepak Pahuja, and the topic we're going to discuss is 3D mapping of clinical data to improve clinical documentation. The topic is presented by Aerolib Healthcare Solutions, and we are a patient-centered total quality management consulting firm. We specialize in the importance of documentation right from the triage process and involve all the participants in the process. I am the Chief Medical Officer and CEO, as well as a physician advisor for hospital Medicare compliance. The website is aerolib.com, and you can reach me at ceo@aerolib.com. As you already know from my previous presentations, we always start with a clinical case. And these two cases, as seen on the slide, are an 85-year-old male presenting to the ER with 2-week history of worsening shortness of breath, weight gain of more than 40 pounds, and swelling of his legs and scrotal area. Our second case is a 68-year-old male presenting to the ER with 1-week history of shortness of breath with findings of elevated troponin levels, evidence of heart failure by labs and chest x-ray. What we hope to achieve with this presentation is to justify and find keywords in the electronic health record that can describe the condition and status of the patient. What we'll describe is how linkage of these words to justify not only medical necessity, but also improve the clinical documentation to decrease audits. It's a way to educate physicians, nurse practitioners, physician assistants, pretty much anyone who documents on an inpatient in the hospital that each word in the record has importance. So what we did was we looked at a 3 hospital system, about total 250 beds. We looked at 45 history and physicals from 9 hospitalists over a 6-month period, where our DRG was congestive heart failure, and all these were inpatient statuses. So let's look at the data now. What we'd like to do is run through a dendrogram, and as you can see, number of words have come up on this. The colors represent clusters. That means how closely those words have been associated. As you can see, there was a large cluster in the green, dark green column about history and physical. The blue is about comorbid conditions. And then there was a brown one for the treatments. What we did is we analyzed all these keywords, and as you'll see in this bubble mapping chart, those keywords will start to associate with each other. The green bubbles are words that are found in the history and the physical. The size of them is how frequently they have been used. As you look at the top left corner, there are comorbid conditions of diabetes, CHF. Words like disease, hypertension, kidney are used, and in the bottom corner, you'll see treatment modalities where IV furosemide, echocardiogram have been used. This is a 3D model where the words are being arranged across the data of those 45 HNPs. Again, the size of the pyramids is the frequency of the words used. And we'll play around with this, do some linkage analysis, and see how strongly those words are associated. We'll try and move these around, and as you can see, even in the second go, they have been arranged into the order in which they have been found in the medical record with frequencies. We'll do some linkage analysis and see how strong these words have been associated. As you can see, they have been separated again into 3 clusters, major clusters of history and physical, treatment, comorbid conditions, and then peripheral clusters on secondary diagnosis, some with UTI, some with COPD. Since these were all inpatients that we were looking at, we do have the power to separate cases by DRGs or by physician names, and thus when we can pinpoint if there is major variation from one physician into different clusters, how strongly those word associations are used by the physician. Now, how does this affect with hospital reimbursement? Most of you have seen these slides where when we use heart failure and shock with a secondary diagnosis of COPD, there's a DRG of 293. And since we're not documenting a comorbid condition or a major comorbid condition, our reimbursement is about 5,700. Let's get more specific by describing the secondary diagnosis of COPD, and we see our reimbursements go up. When we do put in primary diagnosis as heart failure and secondary diagnosis as acute COPD exacerbation with hypoxemia and hypercapnia, again, use of these words on linkage of secondary conditions, you can see the reimbursement that has gone up to about 8,840. I think the bottom line is that the use of every descriptive word by the physician or the nurse practitioner, physician assistant in the record is critical. An appropriate linkage of these phrases that describe the disease process and medical care provided is the backbone of a good and effective clinical documentation improvement program. Feel free to look at our website at aerolib.com, join the Aorta forums for discussions. You can email me at the email provided, and we'd be more than happy to run this analysis for your organization. Thanks.